Hi guys, it's your pal Dr. Sal, and today we're going to take a look at Abilify. We're going to look at the 5 most common side effects you might need to consider if you're considering going on Abilify. Join me now. Abilify, aka Aripiprazole. Now I know that's quite a mouthful, but that's the chemical name for Abilify. And trust me, I don't name these chemicals. But the way I was able to remember it when it first came out onto the market was from the word ability. So it's Abilify, it's extending your abilities. One of the first things that stands out with Abilify is that unlike all the other drugs that I've detailed so far on my show for treating depression and mood disorders, anxiety, etc., working on the serotonin receptors, Abilify is actually an antipsychotic. Now, that should strike you as a little psychotic. Why would you put somebody who's just feeling a little down or their cat died or whatever, why are you going to put them on an antipsychotic? Well, you just hear me out. There is some sense behind it. It's actually licensed not as the primary treatment for mood disorders, but as an adjunct, something that you add to the other guys. So if you're already on Prozac or Zoloft or clomipramine or one of those standard traditional agents for treating mood disorders, and they're ineffective, or you need an extra boost, or you just need a little extra push to feel better, the Abilify is licensed as an add-on to those agents, not as a primary agent. And one of the big differences is if you're using it for a mood disorder, usually the dose will go from 2 to 15 milligrams for a mood disorder. But if you're using it for true psychoses like schizophrenia or bipolar disorder, for example, the doses are about twice as much, so up to 30 milligrams. So that's one of the big differences. Same drug, but different dosing for different folks. So how does this drug work? Most of the other antidepressants work on serotonin, so they're SSRIs or SNRIs, where they're working on norepinephrine as well. This fella here, because he's actually an antipsychotic, works more on dopamine, and it also has some serotonin tweaking. So what we found in studies is that in people who are recalcitrant or stubborn to respond to standard SSRIs, or there's still some distance that they could go to feel normal, if we sprinkle in some of this Abilify, they seem to feel better. Typically, just a little bit of pharmacokinetics. Within 3 hours of taking it, it's 87% absorbed. So really efficient absorption. It also doesn't matter whether you take food with it or not. So that's another little interesting tidbit there. Let me just give you a look at what the drug actually looks like. So here we go. As you can see, none of them are horse pills. They're all fairly reasonable to be able to swallow. All right, so as promised, the 5 most common side effects. So I'm just going to draw a circle here. And before I go on, let me just explain. I've got a lot of flack with math files on prior videos where I've been trying to explain things using what looks like a pie chart. And some of you math files out there realize that my numbers aren't adding to 100. What I want you to think of this is not as a true pie chart, but more as a frequency chart, but in a circle instead of a bar chart. It's much more visually appealing. The optics are much easier to grasp using a circle. Everybody knows what half a circle is or a quarter of a circle. Drawing on a bar chart is kind of esoteric. So anyway, that being said, apologies aside, the most common side effect by far, taking a whole practically quarter chunk of the side effect profile, it's actually 23%. So we'll round it up to 25. 23% of people complain of something called extrapyramidal side effects. I'm not going to bother spelling the rest, just extrapyramidal. What does that mean? Gibberish? It basically means motor disorders from taking it, movement disorders. So ranging anywhere from slurred speech, tremor, rigidity where the muscles don't move right, they're kind of stiff, or I just call it stiff. Jerky, so jerky movements. What else? And spastic, so spasms. So not terribly pleasant side effects. And that's typically the most common reason for people discontinuing it is falling into this quadrant here. Now, one other thing to remember is this side effects that I'm outlaying here is in combination with SSRI. So you got your mood disorder. Actually, let me call that Call that SSRI. So SSRI plus the Abilify. So this is not just Abilify by itself. It's in combination with a SSRI. Because remember, the Abilify is licensed not as primary initial therapy for mood disorders, but as an add-on, an adjunct. So you add it on to one of these fellas. All right, next big one was roughly 10%. It was actually, the specific number was 9%. Complain of feeling tired, aka fatigued. Then another 5% complained of somnolence. Then another 5%, shoot, that was supposed to be in black. Anyway, another 5% complained of sedation. Now you may say, hold up a minute there. Is this just some kind of semantics game here? Aren't these all the same thing? Fatigue, somnolence, sedation? Well, not quite. Medically, we use the terms a little, not exactly interchangeably. They're like little nuances or shades of gray. So fatigue is just like you feeling sleepy. Somnolence means more to do with sleeping much more than you typically would have. So if normally you would sleep 6 hours and now you're sleeping 12 hours a day, we're talking somnolence. Sedation is, in common parlance, would more mean to do with relaxation. So feeling much more relaxed than you normally would with a decreased reaction time. Kind of like after a few drinks of beer, you might be sedated, but you're not necessarily fatigued. You're not necessarily somnolent. If you combine all these three energy crisis side effects, though, that adds up to roughly about 20%. So as you can see, the dominant chunk of side effects for Abilify is either in this quadrant here with motor or movement disorders, and then energy and sleep destruction. Other than that, the Abilify is really well tolerated. All this other side effects here, all these other side effects are less than or equal to 4%. So all the other weird stuff you could get off it, that looks like 40, it's actually 4%. So very, very well tolerated in general. If you compare this to the profiles of some of the other SSRIs that I've detailed on other videos, dramatically better tolerated, except for these two quadrants here. These are the real deal killers for Abilify, these two here. And typically with SSRIs, you're always worried about weight changes. Well, increases in weight with this guy is almost negligible. It's 3% of people complain of weight gain versus 2% just on sugar pills, placebos, also complain of weight gain. So to me, that would suggest that it's only really 1% or maybe even none. So it's pretty much weight neutral. So where does this fit into my whole pantheon of drug therapy for people suffering with mood disorders? Well, typically where I would use it is in a minority of patients that I'm treating. We try several different traditional SSRIs or SNRIs. So I rotate through some, each one I work up to at least half the dose, and either it doesn't fit for them in the sense that they're getting some kind of side effect that they can't push the dose hard to make it perfect, so they get them back up to full speed, or they they're able to progress the doses on these agents, but in each case it still leaves something to be desired. They're still not quite there. Another group that I tend to consider it for is where there's a strong insomnia component. So if I have somebody coming in and they're really depressed or really anxious, and they also tell me they just can't sleep, they're up at the crack of dawn, they're falling asleep at 2 a.m. and it's fractured all through the night, I often will consider adding this in also for those cases. So ladies and gentlemen, that's Abilify in a nutshell. Thank you so much for watching.
Thanks for watching. Get notified of new videos. Subscribe now.